Hello, if you're an individual who has been on any of these three, Lipitor, Crestor, or Zocor for any period of time because you're being treated for high cholesterol, then I'm telling you that the information that we're about to share with you in this video is going to be of great value to you. Hello, my name is Dr. Robert Bartosh of Proactive Wellness and Injury Center in Danville, Illinois. And there are some things that are going on that you really need to know about, because for every action, there's always an equal and opposite reaction. And as I said a few moments ago, if you've been diagnosed with high cholesterol and you're being treated with Crestor, Zocor, or the Lipitor, then you really need to have a talk with your doctor, because frankly, your problem that's being created is a depletion of an enzyme in your body called CoQ10. CoQ10 is produced by the body, but when you're taking these statin drugs, it's actually being depleted. And when it does so, what's happening is it's starting a cascade of events that can eventually increase your risk of having a heart attack or dying of a stroke. And it's not something that you want to continue to do, and it's something that's totally preventable. Let me share with you some information here, and I've written this down so as not to misconstrue it, but we're going to sound like one of those TV commercials for a drug where they tell you you take it for this particular ailment, but if when you do take it, you can suffer these things. Well, when you take the Crestor, the Lipitor, or the Zocor for a period of time, and it's going to vary from person to person, these are some of the things that can result in you health-wise. When this happens, the CoQ10 deficiency can cause fatal cardiomyopathy, heart attacks, congestive heart failure, which usually carries a death sentence within about 5 years, exhaustion, cancer, myopathy, depression resistant to antidepressants. So what I'm saying here is that you can become depressed with a particular type of depression where you are actually resistant to antidepressant drugs. Also high blood pressure, gum disease and tooth loss, hair loss, liver disease, sudden complete memory loss or amnesia. Listen, this is not gradual. This is sudden and it's complete loss of memory and or amnesia, cataracts, angina, cancer, folic acid deficiency, damaged cell membranes, and if that's not enough, there's a whole lot more that can happen. So what happens is when you're taking these statin drugs, it reduces the CoQ10 in your body, and the LDL, you otherwise you know it as the bad cholesterol. Well, when the CoQ10 goes down, that bad cholesterol, if you will, becomes oxidized, and then it results in the cholesterol, that particular type of cholesterol, it causes it to drill holes in your arterial walls. It literally drills holes in the walls of your arteries, and that causes an inflammatory response. And as the inflammation increases throughout not only the arteries but in the heart and through the whole circulatory system, it sets you up for having a heart attack or a stroke. So what are you to do? Well, I want to share with you what we do with our patients. When we have patients coming into us that are on statin drugs, what we do are particular and specific types of blood tests. Now, what you can do is go to your doctor, your treating physician, with your concern and ask them to check out your CoQ10 levels. And the test that you'd want to have them order is a cardio-ion test. It's called a cardio-ion test, and or a very specific test we use. It's very sensitive, and it's called hydroxymethylglutarate. Hydroxymethylglutarate. That's another type of blood test to gauge the level of CoQ10 in your system, because when the CoQ level gets to a certain amount, or I should say when it reduces to a certain level, your doctor would be able to prognose or to tell you that you would die within 6 months. That's how critically important this CoQ10 is. The easy fix is this. Number one, again, just to review, have your doctor, have him or her check out your CoQ10 levels. You can do it with a cardio-ion blood test, or the other one, the hydroxymethylglutarate test. Have that and find out what your CoQ10 levels are. If they're low and you want to continue on the statin drugs, then start to take a very good, high quality CoQ10 supplement that will offset the deficiency. If you want to become more aggressive, realize this, that over 40 to 50% of the people that die from heart attacks don't die from high cholesterol levels, and that is a fact. As a matter of fact, you can Google this. There was research that was done, the Framingham Heart Research, and it showed that more, or I should say that 40 to 50% of the people that died from a heart attack didn't die because their cholesterol levels were high. So you can lower your cholesterol levels naturally if that's a concern. You do so through diet and exercise. Your doctor will be able to help you out. If he or she can't, you contact us, because that's what we do for our patients. And when you do this as well, you will no longer need the statin drugs. You're going to have a healthier life. And again, the issue is not the cholesterol level. That never hurt anybody. It's actually, well, we'll save that information for another video. But again, the bottom line for this video is that if you are on Lipitor, Crestor, Zocor for any amount of time, you want to find out what your CoQ10 level is, and then when you do, you can take the appropriate action. And if your doctor can't help you in this vein, again, please feel free to contact us, because that's what we do for our patients. Again, I want to thank you for viewing this video. We appreciate any comments or any questions that you might have. You can put them in the area that's provided below. And as always, and until the next video, God bless.